We're here today to focus our attention on the state of dental care services within Medi-Cal managed care and the fee-for-service program. The reason for this hearing is to address many of the concerns and issues raised earlier this year when in May our budget subcommittee discussed the shocking lack of access to dental care in Sacramento. That issue has received lots of media attention through the Sacramento Bee in the northern region of the state. Most of the early attention focused on Sacramento, primarily because Sacramento only has managed care, it has geographic managed care, and many participants have no other choice in their dental services. The reason we wanted to come here to Los Angeles was because while most of the media attention focused on Sacramento, we recognize that tens of thousands more children here in LA County were also having issues with regard to access to care, even though here in LA County they have the fee-for-service option. So we really wanted to come here and have a meaningful, lengthy conversation to see if we can get to the root of the problem. While, of course, this is an informational hearing, we are hopeful that we'll learn from today's hearing, what we learn from today's hearing will foster substantive policy discussions that will improve access and health outcomes for children in LA County. According to a 2000 report by the Surgeon General, dental decay was identified as the single most common childhood disease, 5 times more common than asthma. It's referred to as a silent epidemic. Poor children were more likely to have up to 12 times as many restricted school days per year due to dental illnesses. To say that oral health is imperative to the health of children in LA County and across the state is clearly an understatement. While we in the legislature have been forced to make cuts so severe that California's safety net is now more a memory than a promise, that clearly is no excuse for not ensuring that the services to which children are entitled are truly accessible to both the children as well as their families. I remain committed in providing the proper legislative oversight to ensure that children currently enrolled in Medi-Cal and those transitioning from healthy families will have access to critical dental services. And so our goal here today is to ensure that the concerns about network adequacy and access to care are met during this expansion of the Medi-Cal program.